Hello, and welcome to Grand Rounds COVID-19 edition. A place where cancer patients can get all of their questions answered by medical experts. I'm your host, Jonathan Summers. As we are slowly coming out of isolation, please remember we still need to be responsible and remain socially distant. And with that, let's meet our panel. Today, we have a pediatric oncologist, Dr. Becky Johnson. Could you please introduce yourself?
Hi, I'm Becky Johnson. I'm a pediatric oncologist taking care of kids, teens, and young adults at Mary Bridge Hospital Multicare Health System in Tacoma, Washington.
Thanks. We also have an adult oncologist, Dr. Irene Kang. Would you mind introducing yourself?
Hi, everybody. My name's Irene Kang. I'm a medical oncologist specializing in breast cancer at the University of Southern California, Norris Comprehensive Cancer Center.
Thank you for what you guys are doing. Now, as oncologists, have you noticed the rates of new cancer diagnosis in your clinic have gone up or down during COVID-19 when compared to previous times? Becky, what's your thoughts on the matter?
Yeah, I think that we did initially see that trend. When COVID first hit, there was a lot of discussion in the oncology community as to how to proceed, how to take care of patients that were coming in, and in general, what we could expect for the next few months going forward. And one of the big concerns expressed is that people would stop coming in for healthcare if they could possibly avoid it, and that new diagnosis rates would go down. And in fact, in the first month or so during March, we did see, I would say, about the same number of hematologic malignancy diagnoses, new cases of leukemia. Those patients get so sick that they really need to come in.
Dr. Johnson, could you explain what that term means? Hematologic?
Yeah, those are blood cancers. So cancers where the main cancer is growing in the bone marrow. And that tends to cause anemia, where people get very, very fatigued. They feel very ill, and sometimes come in the hospital because they're just feeling so badly. It can also cause low platelet counts and bleeding. And so what we saw is that those patients continued to come into the emergency room because, again, they were just feeling so bad. Whereas during the months of March and early April, at least, we perhaps saw fewer solid tumors because people were avoiding the healthcare system at all costs and weren't maybe getting their lumps and bumps checked into. However, we've seen a little bit of a resurgence of that. And so if you count up all of the cases since the COVID epidemic started, it's pretty much our group's norm in terms of cancer diagnoses. So I think people were avoiding the clinics for a while, but now things are getting back to business and people are willing to come in to be evaluated.
That's great to hear. Dr. Kang, what have been your experiences during this?
I would say I would echo Dr. Johnson's experience that there was indeed a drop, especially in March when initially a lot of shelter in place and strict isolation measures were put in place to protect the healthcare system and make sure we had enough capacity to take care of very sick patients. However, a little bit different from the blood-based cancers, solid tumors like breast cancer oftentimes depend on screening mechanisms to catch them early. So screening mammograms, screening colonoscopies for colon cancer, and those diagnostic tests and screening tests have been were initially put on hold, and the capacity was much diminished during the initial stages of the pandemic. And so we did indeed see a drop And we see this, I think, worldwide. It's been reported out of public health groups in the Netherlands. And I think it's something that's very recognized by the oncology community. We recognize that cancer is a disease that needs to be treated, and despite the ongoing pandemic. And so the concern is that if we delay diagnosis, we'll have potentially a backlog of patients when the healthcare system opens up fully, and also that we don't want to have patients have poor outcomes because of delayed diagnosis. So I think there's certainly at our institution, we've opened up screening mammograms again, and there's the message, a really important message to get out to patients there, that if you're worried about a lump, a bump, an abnormal symptom, you need to get checked out, and that the healthcare systems are doing their best to make the clinic and the healthcare setting a safe place.
It sounds as though you both are trying to avoid a delayed diagnosis, which is very important for a cancer patient. Dr. Kang, I have another question for you.
Sure.
I imagine that you had many appointments with patients through, let's say, video conferencing. How's your experience been?
It's definitely been a learning curve. I think telehealth has really come to prime time because of the pandemic, but it's been a really important way to deliver healthcare safely and effectively to patients. We've been very lucky to have strong infrastructure to allow delivery with both video as well as audio conferencing with our patients. It's allowed our waiting rooms to become a lot less crowded, and so to make both the in-person healthcare encounter as well as the telehealthcare encounter be a protective measure for both patients and providers. I think it's also helped stretch the reach of healthcare to be an easier way to access healthcare for patients who have maybe trouble traveling long distances or making their appointments. So in general, I would say it's been quite positive. However, it's not the right thing for every patient, and sometimes a patient really should be seen in person. And so that's something to, I think, discuss with your provider directly.
Thank you for that. Dr. Johnson, same question to you.
We've had a similar experience to what Dr. Kang describes. I was really amazed by how quickly our institution was able to pivot and begin doing more virtual visits when the shelter-in-place orders came out. People have been talking about virtual visits as a way to extend the reach of the healthcare system for over a decade, and I've always been surprised that we don't use them more. And so it was very interesting and instructive to try them out, on short notice and see how they worked. There are some definite benefits to it. It's so easy for the patients to log on. Not as easy as a FaceTime call. There are some, kind of red tape and the nurses checking them in that create a little bit of hassle, you might say, that is perhaps less time consuming than it would be to actually go to the doctor's office, but it's not nothing. However, I think it's convenient for patients and they really appreciate it. We found in our clinical setting, where we see both kids and teens and young adults with cancer and also with other blood disorders like sickle cell disease, that often when we were needing to see patients, they were needing to get lab work. And so it wasn't a way that we could save most people any kind of a visit to the healthcare system. If they didn't come to our clinic to get blood work, they would need to go somewhere else often to get blood work. And then we could review their results and talk to them on a video call. And that worked well. We've now mostly gone away from video calls and back to office visits with social distancing protections in place and everyone masking. People are screened at the front door. But in that way, we're able to do the labs. We're able to, of course, deliver chemotherapy, which we never stopped doing, even during the height of the shelter in place. But we're also able to examine patients, and they're definitely, even with social distancing, we find there's some benefit in seeing people face to face in terms of picking up new problems and working them up.
I'm very happy to hear that. Thank you. Lastly, it's our fan question. It comes from @LEC27. And the question is, are you currently receiving the PPE that you need? Dr. Kang, why don't you give us your response?
Great, thanks. The short answer is yes, and we've been truly blessed by a lot of generous donations from people in the community, and also supported by our institution. And it was a really scary time early on when there was a shortage, but we feel very supported at the moment. Thanks.
Wonderful. I'm really happy to hear that. Dr. Johnson.
We also at our center do have the PPE that we need. There are commercially available masks for all the healthcare providers, and there have been many generous donations from the community to provide homemade masks, cloth masks, that are given out to patients who don't have them or who don't bring their own masks when they come in. And so those are nice. They're reusable and people can keep them. And healthcare providers have not needed to use homemade masks at all. And people who are in high risk positions have the N95s, the face shields, and all the equipment that they need for aerosolizing procedures.
I'm so happy to hear that. I know that you both are very busy. I appreciate your time significantly. Please stay healthy, keep doing what you're doing, and I look forward to speaking in the future.
Thanks, Jonathan.
Everyone stay well.